Hi everyone, I'm KANG Year 1 UMS medical student, and today let's talk about respiratory system. And firstly, we talk about anatomy of lungs, and we start from the upper respiratory tract, which consists of the nose, pharynx, and larynx. In the nose, we have the nose and the nasal cavity, and more. But here we state nose and nasal cavity, which functions to warm, humidifies, and filter incoming air. The next one we have our pharynx, which conducts air and food, and the nasopharynx also handles the air. And lastly, we have larynx, which prevents food to enter in the part of epiglottis and also for voice production. The next one we have lower respiratory tract, and first thing we have our trachea and bronchi and bronchus. And so let's talk about trachea. Trachea functions to conduct air to bronchi, and it also contains mucus production to trap particles. The next one we have bronchiole, which air distribution for each lung lobes. And last one we have bronchioles, which control the air flow resistance and also air distribution. And the next one we have alveolar ducts and alveoli. This here are the alveoli, and which functions to channels air into the alveoli sacs for gaseous exchange, and the alveoli functions for gaseous exchange. And the next one we have our lungs. The lungs we are going to talk about some things such as lobes, pleura, and vasculature. Firstly, the lobes. We have separation of lungs region for efficient ventilation. For example, right lung has three lobes and left lung has two lobes. So the next thing is pleura, which reduce the friction for during breathing, but it's not stated in diagram. And the next one is vasculature, which is the blood supply for gases exchange. And next, we need to talk about the diaphragm and respiratory muscles, which diaphragm contracts during inspiration or inhalation, and to expand the thoracic cavity, and same as exhalation is just vice versa. In the intercostal muscles exist in thoracic expansion and contraction. However, it's not stated here. It's located in the ribs. And lastly, we have accessory muscles, which is aid in forceful breathing. Um, Next, let's talk about some histology of respiratory system. In respiratory system, we have conducting zone, which is from the nose to bronchioles, which lined by pseudostratified ciliated columnar epithelium with goblet cell and that secrete mucus. And next, we have cartilage provide structure to prevent airways collapse, such as trachea and bronchi. And last one, we have smooth muscle that regulate airway. And furthermore, we have respiratory zone, which is from the respiratory bronchioles to alveoli, is lined primarily by simple squamous epithelium for gaseous exchange in alveoli. And we have two types of pneumocytes, which is type 1 and type 2 pneumocytes. Type 1 pneumocytes functions is to form the alveoli wall and allow for gas diffusion. And they are thin and flat cells. The next one is type 2 pneumocytes, which produce surfactant to reduce uh, the alveoli surface tension. And the last one, we have capillaries which surround the alveoli to form a blood-air barrier for gas exchange. For the physiology process of respiratory system, we have pulmonary ventilation, which is breathing or F movement, which consists of inhalation and exhalation. Inhalation is consists of the diaphragm muscles contract and move downwards. Intercostal muscle contracts and expand chest cavity, thus causing the lung volume to increase and creating a negative pressure than atmospheric pressure, so that air is drawn inside the lungs. Next, we have exhalation, which diaphragm and intercostal muscle relax. This is to create a volume decrease in chest cavity, thus creating a positive pressure than atmospheric pressure to push the air out. Now let's talk about gas exchange, which consists of oxygen and carbon dioxide. So oxygen diffused from alveoli, which is high partial pressure, to pulmonary capillary of blood, which is low in partial pressure. CO2 diffused from the blood to alveoli for exhalation. So let's talk about oxygen transport. And oxygen transport is transported in two forms, which is hemoglobin. Uh, Oxygen binds to hemoglobin in red blood cells, which to form oxyhemoglobin. And the next one, oxygen binding depends on the partial pressure of oxygen. And oxygen hemoglobin distribution curve shows oxygen released to tissue under low oxygen conditions. The next one, we have dissolved in plasma oxygen, which is around 2%, and small amount of oxygen dissolved directly into the blood. And the next one, we have carbon dioxide transport, bicarbonate ions, around 70%, which CO2 reacts with water in red blood cells, which catalyzed by carbonic anhydrase to form carbonic acid, and dissociates into hydrogen ions and bicarbonate ions. The next one, we have hemoglobin, around 20%, which carbon dioxide binds to hemoglobin to form carbaminohemoglobin. The last one, we have dissolved in plasma, around 10%, which small amount of CO2 dissolved directly into the blood. And now let's talk about biochemistry of respiratory system. And we have gas exchange and hemoglobin function, which hemoglobin ability to bind with oxygen depends on the factor like Bohr effect and CO2 levels. And this is the Bohr effect, the table or the graph. And the Bohr effect is actually uh, shows that increased carbon dioxide has low pH, thus high temperature, and it will shift the curve to the right to promote the oxygen release to tissues. A left shift on the opposite condition will increase the hemoglobin's affinity. And next, we have CO2 levels, which decreased pH will increase the partial pressure of carbon dioxide, thus causing oxygen binding affinity of hemoglobin decreases and oxygen is released to the cells. And next, we have acid-base balance. The lungs regulates blood pH by modulating CO2 levels. Thus, we have an equilibrium between carbon dioxide, H2CO3, and bicarbonate ion is central to pH regulation. And we have a formula which is CO2 plus H2O will equals or reversible to H2CO3 and reversible to hydrogen ion plus bicarbonate ions. Respiratory regulation of pH consists of hyperventilation and hypoventilation. Hyperventilation eliminates excess CO2, thus decreasing H plus and raising pH. Hypoventilation retains CO2, increasing H plus and lowering pH. And next, let's talk about emphysema, which is a disease related to respiratory system. And it is a chronic respiratory disease that primarily damages the alveoli in the lungs and leading to breathing difficulties. Causes include smoking, long-term exposure to air pollutants, genetic factors, aging. And the symptoms include shortness of breath, persistent cough, wheezing, fatigue, weight loss, and barrier chest. The diagnosis includes X-ray or CT scan, atrial blood gas, and also pulmonary function test. For treatment, there is no cure for emphysema, but it can relieve symptoms such as taking medications, HCT. And lastly, the famous practitioner I chose for this topic will be Associate Professor Dr. Avria Ban Yulin. She is a consultant physician and pulmonologist in HCTM of UKM, and she did a lot of research, including in asthma, COPD, and tuberculosis. And the link included in the slide contains her research. And she also published and presented in national and international congress. And that's all about the video. Thank you for watching.